Jacqueline has stage 4 cancer. After suffering with breathing problems, she was rushed to A&E. She waited over 24 hours for a bed in a ward.
So I couldn't breathe. I couldn't even get a word out properly.
The length of time having to wait, and like so she couldn't get a meal or anything because she was in A&E, because you got to wait until you get into a ward to see a doctor and stuff. But the 24 hours is just ridiculous.
Just over 66% of patients at A&E were dealt with within the government's 4-hour target. More than 7,700 people waited longer than that, while 944 patients were in hospital for over 12 hours.
We've had record levels of hospital occupancy with COVID. We've had high levels of staff absence. And so there's no doubt that unfortunately people have had to wait longer. And of course, I regret when anybody has to wait longer than is acceptable. I would expect, now that we've seen some of these numbers come down in terms of COVID hospital occupancy, my expectation would be that there will be an improvement in these figures.
We know it costs lives. People die unnecessarily because of these delays. It's an example, again, of Humza Yousaf not knowing what he's doing when it comes to accident and emergency and medicine and the NHS in general.
In an effort to tackle the increasing backlogs, the government are recruiting 1,500 additional staff.
The Scottish Government talk about numbers all the time, but it's not about numbers. Numbers misses the point. It's about whether we have, not if we have more staff, but enough staff to meet the needs of the people of Scotland, and clearly we don't currently. At the moment in Scotland, there's over 6,700 nursing vacancies.
So today we are going to look at surgical gowning and gloving.
At this training session, these already qualified nurses are learning new skills to plug the gaps in surgical wards.
They are up and running within the orthopaedic setting, and we've got them in 6 months to be scrubbing up independently for hips and knee joints. So that's a massive task, and it's a lot of work is required for it.
We've been taking on surgeries from other hospitals that we previously hadn't been doing. So as nurses, it's been good to get a chance to expand our skills and see these surgeries.
We don't really do this at university, they mention theatres, but it's so specialised, it's something you need to work in.
Senior health professionals have said the NHS has never faced a crisis worse than this.